Midstate Health Center is here for you, providing exceptional care for your family in your own community. With offices in Plymouth and Bristol, New Hampshire, Midstate is on a mission, providing accessible primary health care for everyone in the community, regardless of their ability to pay. The health and well-being of our community is at the center of all we do. Midstate is driven by a single mantra: we do what is right for the patient. We promise to be here for you, your family, and the entire community. Offering a wide variety of services, Midstate's team works together to meet your healthcare needs, whether it's primary care, dental services, mental health, X-ray ultrasound, or substance use recovery services. We are here to help every step of the way. Midstate Health Center, where your care comes together.
Good afternoon. Thank you all so much for joining us today for Midstate Health Center's virtual annual meeting 2020. Although we would have preferred to be with you in person, we're delighted to see so many familiar faces on our computer screen right now. Thank you for taking the time to join us. My name is Audrey Gowdy. I'm the Director of Marketing, Communication, and Philanthropy at Midstate, and I'm pleased to serve as the MC of today's meeting. In just a moment, we'll be highlighting a few of Midstate's most proud accomplishments from the past year, as well as share with you some of our exciting plans for the year ahead. Before we get started, there's just one housekeeping item to address. Your microphones were all muted when you joined the call to limit any outside interruptions. However, we encourage anyone that has questions or comments during the meeting to please type them in the chat box at the bottom of your screen. Upon the close of our meeting, we will leave time for questions and answers with members of our Board of Directors, which will be moderated by Wendy Williams, our Director of Grants and Programming. Thank you again for joining us today. We hope that you enjoy what we have prepared for you. Now I'd like to turn the meeting over to Midstate Health Center's Chairman of the Board, Tim Nero.
Welcome. For those that don't know me, I'm Tim Nero. I'm the Chairman of Midstate Health Center. And I want to welcome you today to this meeting. And I really appreciate the time you're taking to attend the meeting. Please review all of the board members. I'm not going to go out and introduce all the board members. You could go to our website and see them there, or pick up our annual report, because they're a critical part of this whole organization, and it's their leadership that has led us down the road that we've traveled over the last year. 2020 has been a very difficult year with the pandemic coming down the road. We all know that. This institution took that on head on and continued to serve its members and its patients through this pandemic. We have 11,000 plus patients who we really, really welcome and are proud to be serving you. We have 150 employees who are dedicated to serving the community and have done a great job of keeping this institution open. I'd like to thank from the janitorial service who's disinfected the buildings, to the staff that checks you in, to the nurses and physicians who complete your visit. They've all done an outstanding job, and in my view are the heroes of this organization. I'd like to thank everybody outside the organization who has supported us, our groups as far as the Select Board, the healthcare institutions around us, Spear Memorial Hospital, Pemmy Baker, health organizations, and anybody else who worked with us. We really appreciate the work they're doing. I really thank you for being here today, and I'll now turn this over to the CEO, Bob McLeod.
Welcome everyone to our annual meeting on behalf of Midstate. My name is Bob McLeod, and I'd like to talk to you about what we've been doing and our vision and our mission. Let's start with our vision, which is we want our community to be as healthy as possible through holistic and integrated care. Our mission is quite simple. We want to provide the best possible primary care, oral health care, behavioral health care, as well as related services to our entire community, irrespective of one's ability to pay. And we think we do this quite well. And we think that we have grown quite a lot over the past year or so in providing more services to our community. For example, one area that I'm very proud of is our new imaging services that provides both X-ray as well as ultrasound services. What a game changer that has been for our practice and for the clinicians that offer the referrals to us. It's huge. So many things that we have been able to roll out where people don't have to go to another healthcare organization to determine the status of their health. It allows our clinicians the ability to provide those services at a reasonable cost without anyone leaving our organization, and do it in a timely fashion so that they leave here with little or no questions about what their diagnostic status is. Our imaging center has been a game changer for us. In addition to that, we continue to expand oral health services. In Bristol, for example, we are looking to go 5 days a week instead of 4 days a week. And even during the COVID crisis, we've been able to keep our services open. Where other oral health practices have needed to close, we kept ours open for emergency services. And we were one of the first to open it up again for full services. We've done it for 4 days and now 5 days. We're increasing our services of hygiene, and we're opening up services more in the Plymouth area for people that need the prophylactic services that they deserve to maintain their health. We continue to be the leaders in that service, not only internally, but also externally to communities. We do our oral health program in the Newfound area school system, and it's been a huge benefit for the children that need these services that they otherwise could not have. In addition to that, we continue to enhance our behavioral health services. And we've done a lot of that during this pandemic through telemedicine. But there's more to come. Not only are we going to provide psychology services and mental health services, we're also providing telepsychiatry services for those that need an extra look, an enhanced look by a qualified provider. On top of that, we now have at our Whole Village location substance use disorder treatment as well as intensive outpatient treatment. This has never been done in this community before, and we've done it in partnership with other stakeholders, where we now have a comprehensive approach to treating people with substance use needs. And it includes not only counseling and intensive counseling, but it also includes medication-assisted treatment program that has been a game changer for many of the people that have experienced opioid addiction. And we're going to continue with doing more with that and expand those services and add more programs to our Whole Village site. On top of all of this, we also now have opened up our access to immediate care in both of our facilities, both Bristol and Plymouth, where we do same-day services for patients who need something that day, whether they're not feeling good or whether they have some other issues. We try to get them in that same day. It may not be with this same provider that they're used to, but we will get them to see one of our qualified providers that's always on duty for these services. And on top of that, we've been the leader in this community now of doing COVID testing, in which this has helped us and helped these families rule out concerns that they have if one of their family members tests positive for COVID. We can do this in 15-minute turnaround time. So patients can come in, have their test, and leave here and know whether they have tested positive or not for COVID. Why is that such a big deal? Because many of the children in our schools might be sent home because they've shown some symptoms that might lead them to think they have COVID. And what happens is that our families have to stay home and take care of these children. And now we're able to turn around those tests in such time where the children can get back to school and the family members can get back to work. That makes a huge difference, not only from a clinical standpoint, but it does from a financial standpoint. And last but not least, let me talk about our Children's Learning Center, which has been a gem in our crown for a lot of years. And we now have moving forward to expanded services and expanded slots to accommodate more children over the next 12 months or so. We're excited about this prospect because soon we'll be rolling out our plans to move our Children's Learning Center from its existing site to one that will be able to accommodate 4 times the number of children that we're able to do now. Child care services, particularly quality child care services, is in desperate need for our community. And there are many parents that can't go to work because they have no place to put their children. And we also are going to provide a building, a facility that not only will be suitable for the children, but it will also be green friendly. It will be environmentally friendly. It will also be a learning opportunity for the children that will see a building and see how it works in a fashion that's environmentally favorable. Finally, let me say that we can tie all of this back to what I said our mission was and our vision is. It's treating the community as the whole person, not only from a medical standpoint or oral health standpoint or behavioral health standpoint. It addresses the social determinants of health. One of the most important programs we have right now is our Feed the Need program. The number of kids, the number of families that go through the month that are food insecure no longer have to be food insecure, because we'll connect them up with some of our gift baskets, as well as then we'll connect them with sustainable programs that will address their needs so that no one is going hungry at the end of the day. Not only children, but even those at midlife people or those that are elderly that run out of funds before their next Social Security check comes in. No longer has to worry about where to go. They can come here at Midstate, where we'll take care of them and do what we can to get them on the right road to good nutrition and have appropriate sustenance every day, every month, every year. Thank you for attending this annual meeting. And now I'd like to turn it over to our medical director, David Fagan.
2020 has been a year of great challenges for the country, our community, and Midstate Health Center. However, it's also been a year of great reward at meeting those challenges, which I think has put our clinic in a better position than it was when the year started. It's hard to imagine now that there was a time before COVID hit us in March. That's when I was asked to lead the clinic's newly formed COVID task force and then became medical director. At first, the task force met daily. This was all new to us, nothing we had studied in medical or nursing or business school. New policies and procedures were happening by the hour. At the end of a single day, it seemed like weeks had passed. The first thing that we did before the CDC or area hospitals even started recommending it was to institute a mandatory mask-wearing policy to protect our patients and staff. Next, we developed front door screening for all patients and staff before they entered the building. And then we set up an outdoor tent, now moved inside, to see patients who had potential COVID symptoms in a space separated from the rest of the clinic to keep everyone safe. This was to assure patients that we will do everything possible to keep them protected when they came for their appointments. Now, the screening and COVID tent were enormous undertakings that were led by our hardworking and dedicated clinical director and staffed by really brave medical assistants, nurses, physicians, nurse practitioners, and eventually all Midstate staff, even our managers and CEO. In fact, this might be the only place where you could be greeted at the door by the administrator checking your temperature. And they withstood cold and wind, rain, heat, bugs, and especially fear, because we didn't really know our risk at that time. I can't emphasize enough how dedicated the staff has been in potentially risking their own safety to keep the clinic open to serve the community's health needs. Seeing this has inspired all of us to work harder. And having the screening, COVID tent, and face mask policy has allowed us to remain fully open throughout the entire pandemic. Unlike some hospitals and clinics, we've never laid off a single employee or closed our services to anyone. We developed our telehealth to serve patients by phone or video who can't come to the clinic. We also use telehealth to treat Midstate patients who are sick with COVID and allows us to see them even daily if needed, to closely monitor their progress. Telehealth has allowed us to continue to address the mental health needs of Midstate patients, which have greatly increased due to the pandemic. We also continue to address the community's substance abuse crisis with our recovery services. We've improved safety for dental patients with improved airflow exchange and protective equipment. We opened our imaging center where patients can have x-rays at Plymouth and ultrasounds at both the Plymouth and Bristol offices during their visits. That's a great convenience to patients and clinicians. We've added new providers this year, including Dr. Regan in internal medicine, Dr. Bentwood in family practice, and Dr. Gaudet in dentistry. We've started doing rapid COVID testing, which is available to Midstate and non-Midstate patients for anyone with symptoms in the past 5 days, and it gives results in 15 minutes. This has allowed hundreds of kids to get back to school and parents to get back to work without waiting for days to get results. What can we expect over the next several months? Well, we've started a new psychiatry service using telehealth to assist our clinicians and behavioral health providers with prescribing psychiatric medications. Upcoming building renovations will allow us to provide COVID screening and visits for potential COVID patients, especially for this winter. I've been really grateful and humbled to have been part of the Midstate organization this past year and feel we've developed a remarkable staff to carry us through with whatever challenges we might face in the coming year. Thank you.
Thank you, Dr. Fagan. Although it's been a year filled with uncertainties, Midstate has continued to grow its services even during these unusual times. Please sit back and enjoy the following video of Midstate's new on-site imaging center.
This program started to produce high-quality exams for patients of all economic diversities across the state.
We were able to provide the physicians what they were looking for, basically to get the reports, the imaging more timely for their patients so that they can treat them.
We are providing x-ray services, ultrasound, vascular ultrasound, GYN services, as well as some musculoskeletal ultrasound. Our response has been great. We are seeing approximately 15 to 25 patients a day. A variety of exams we're doing from x-ray to ultrasound, vascular ultrasound, and some MSK. We are seeing patients from all over the state that are coming to see us.
Before, they would see the patient and then they would send them off to get their imaging exam somewhere else and then wait for the report to come back and then contact the patient. Well, now the patient is in the room, they see them, there's a problem, they can come down here and then get their x-ray or their ultrasound right away. In most cases, particularly with ultrasound, they can get immediate results because usually Amanda or myself will, if it's something that we're concerned about, we'll go and tell the physician so their care becomes immediate.
We have many patients that come to Midstate Health that have transportation issues, elderly patients, moms and dads that are coming in. By having radiology services here on site, we're able to offer same-day appointments, usually at the exact same time of the appointment. We do that with very little wait to the patient. Some of them have to be scheduled to come back so that they're prepped properly for their exams, but we usually get those patients in within the next day.
Well, patients love it. That's one thing. That's the response that we get is twofold in the sense that, one, they don't have to go anywhere, and if they do have to have an exam scheduled, we can schedule them like almost immediately. The way it works is that we do the exams, we save them on our what's called a PAC system, which is a picture archive communication system, which is basically electronic imaging gets sent to Southern New Hampshire Radiology Group, and they do the interpretation. The reports come back to our PACS system, so it's electronic image and then a report, and then we upload those to the medical record within the clinic. It is one-stop shopping. I think the fact that their insurance is already approved for here, so they don't have to worry about is it going to be covered? If I go to this place or if I go to that place. Pricing, we're definitely less expensive than other places as well.
We are providing a one-stop shop for a lot of our patients, from laboratory, if pharmacy needs, to x-ray needs and ultrasound needs. We have our staff here on site provides decades of experience, not to age us, but we've all been scanning and doing x-ray for over 20 years, so we're providing high quality care to our patients.
Next, I'm excited to announce that Midstate has expanded its recovery options available to the community. The program is called RISE.
So RISE Recovery offers outreach services to the community and the county. We have an intensive outpatient program, as well as offering behavioral health services and an MAT program as well.
MAT stands for Medication Assisted Treatment. So patients who have a substance use disorder can use MAT services. Substances typically that we treat with medications are opiate addiction and alcohol dependence.
So our goal is to connect patients with the level of care that is needed for them, that is the most appropriate based on where they are at in their recovery. So as the IOP director, my role is to help design curriculum for the IOP. I facilitate our IOP sessions. I connect various patients with IOP and or higher levels of care should they need it. I also do the clinical write-ups for our IOP patients and basically all things related to our intensive outpatient program here. So at RISE Recovery Services, we truly try to focus on the whole person, not just the substance themselves. We focus on overall health and wellness and providing them with the services they need regardless of their ability to pay.
Medication-assisted treatment is just one of the tools in our tool belt. It's combined with peer support, individual group counseling, and then also making sure that patients are stable in their housing, that all of their basic needs are being met. So all that combined together is a formative program, and that's when patients are most successful.
RISE Recovery Services officially started in February of 2020. It was very difficult to get off the ground because of COVID-related issues. However, as we've continued to progress and where we're at today, we've grown the program to over 17 patients, and we've also had 2 graduates and those also that take part in our relapse prevention program. So the need is definitely there for our resources, and we're happy to be able to offer them to the community. Well, it's definitely a team effort. What we do is we collaborate with the main offices here at Midstate, and we really try to reach out to the community. Part of what we do is build relationships with various resources in the community, various organizations, local hospitals, treatment centers, and so we can work together to identify those patients that are most in need of our services. Well, it can be very nerve-wracking to go into a doctor's office or to seek recovery services. And essentially what we try to do is let them know that they are supported and they're cared for from the beginning. We try to reach the heart of these individuals and wrap our arms around them right away so that they feel like they can more easily go through with this process. Regardless of where you are in the community, you can reach out to RISE Recovery Services. Whether you're located at our Bristol offices, at our Plymouth offices, or the surrounding community, we are available to you. So you can reach out to our offices themselves by stopping by or reaching out to Midstate, and they will connect you with one of our staff members. At RISE, we really seek to personalize and customize your experience here with us in recovery. You can take my word for it, and I could speak all day about RISE, but let me introduce you to Shane, who has been through our program.
When I look back on my life, it's easy to find excuses as to why I became an addict. Emotionally scarred from being raised by alcoholic parents, battling depression from a young age, no one to keep me out of trouble, to stop me from making bad decisions. First, it was alcohol, then pot, cocaine, pretty much anything I could get my hands on. It was easy to forget about everything that was wrong with my life when I was high. So I tried to stay that way, all the time, no matter what the cost. You don't know how low you can go until you hit rock bottom. Lucky for me, I found Rise. They were there for me when I couldn't be there for myself. They gave me the tools to treat my addiction, provided a safe, judgment-free place where I was able to respect myself again. Today, I'm 3 years sober, staying busy, being the person I never was, making every day count, because Rise taught me I'm worth it. Take it from me. I know it's easy to find excuses, hard to say you're ready for help. It's the hardest thing I've ever done.
Well, that story says it all, but we want to say thank you to Shane for sharing your story with us today. And now let's hear about our Feed the Need program. Obviously, even a year ago, the need was identified in the community that many of our community members were food insecure. This year, since the onset of the pandemic, the New Hampshire Food Bank has identified that there are now 1 in 7 individuals in the state of New Hampshire that are food insecure, and 22% of them are under the age of 18. So even more alarming is they've projected 71,000 additional individuals will become food insecure. That's a 57% increase since the onset of the pandemic. So it goes without saying that this is here to stay. This is not going away, and we have a lot of work to do, and we're just one entity out of many that's fighting this hunger problem.
So that's why Midstate started this program, was because we know that this has been a need in our community. And back in November when we started this, we kind of knew that this was something going on. So although this is something that we sensed back in November and something that we saw within our patient population, this is something that has definitely grown since the pandemic hit.
Our donors have really gotten us this far. In 1 year's time, we've raised over $22,000 for Feed the Need specifically. Spear Memorial Hospital, the Bristol Rotary, the Plymouth Rotary, and the District Rotary Clubs have all contributed. The Market Basket in Plymouth, they are allowing us to put a food bin at the exit of their building so that people can make food donations. And the nice part with that is we're going to partner with those food donations. We're going to help complement or supplement our local food pantries. We're not doing this to compete with anyone. We're doing this to complement and get food where it needs to be so that anybody can get food wherever they go. Those partners would be Plymouth Area Community Closet and the Bristol Community Services. So those are the 2 local food pantries. In addition, Bristol Hannaford has assisted us with the bags that we actually use in addition to Market Basket. So many mid-staters have contributed, a lot of staff, and we've had 1 or 2 very generous community members that have made some significant monetary donations so far.
So we've discovered patients from medical appointments, from dental appointments, substance use appointments who have screened food insecure. And these are people that are coming in for a sore ankle, or maybe they need an x-ray on their finger, and they're coming in and we're seeing that they don't have food. So what we do is we have a bag of healthy foods that contains a gift card as well from local grocery stores, and they can leave our practice right that day with a bag of food.
Each Feed the Need bag is intended to feed a family of 4 for 3 full days, all with nutritious meals. And the cost of 1 bag is $27. That's the food, and it also includes a $15 gift card to a local grocery store where they are to go and purchase their fresh produce and their meats to complete the meals that are being suggested by the recipes that are in the bag. So, we're not buying the cheapest food to put in the bag. We really would like this to be nutritious and get people educated on how to make a healthy meal at a short cost.
So I think that since the program started last November, we've had a lot of really great community feedback. UNH Extension was critical in planning of the bag, as well as Midstate's own dietitian. So they helped us kind of figure out what enough food was to go in the bag, what healthy foods we could put in the bag, how to get the most bang for your buck. So what we do is we actually go shopping. The Midstate team will go to Market Basket or go to Bristol Hannaford and pick the food off the shelves. And and we come back and we, as a team, pack them in bags and we put them on our shelves so that our care coordinators or a member of the care team can just grab a bag off the shelf and give it to the patient.
I think there's many opportunities to grow. We did talk a little bit about maybe having community gardens, health, fresh, nutritious foods. We live in a beautiful state that grows delicious food, so if we could share that and educate folks on how to grow some of their own, there's a lot of places this program could go. So if someone would like to contribute, they can certainly go to midstatehealth.org and click on our Donate Now button. That would be the simplest way. They could also make a monetary donation and drop it off at either our Midstate Plymouth or Bristol locations. They could also stock up on some additional non-perishable goods and put those in the market basket in Plymouth on their way out of the building. Those would be the most simple ways to donate, but always keeping in mind any food pantry is going to be helping to serve all of our community members. This year, as with last, Midstate is committed to its mission of ensuring access to healthy food for those who need it most. And we need your help now more than ever to support our Feed the Need annual appeal campaign. Although hunger is often invisible, it's a reality for many in our community, and it is only increasing. We ask that you consider making a donation today. Please visit midstatehealth.org and go to our Donate Now button. Thank you for your help in combating hunger in our community.